Good afternoon, everyone. My name is Marie Kinsella. I'm the Director of Community Programs for the Partnership of Maternal and Child's Health of Northern New Jersey. And we're here today to discuss a very exciting topic. It's called Centering Pregnancy. I have my esteemed colleagues from different sites who have different roles when it comes to centering. And I will introduce them. And when I introduce you, guys, can you just put your finger up so they'll know that's you? So we have Deborah Katz from St. Joseph's Medical Center. We have Deanna Velasquez from Centering Healthcare Institute. And we have Tracy Myers from Alliance Community Healthcare Center. And so we're just going to jump right into this because this is such a wonderful venture, and the Department of Health, New Jersey Department of Health, has funded these programs because of their commitment and dedication to improving birth outcomes in the state of New Jersey. So Deanna, if you don't mind, I'm going to start with you. And so I'd like you to fully introduce yourself. And the question I have for you is, what is Centering Pregnancy?
Yeah, absolutely. So my name's Deanna Velasquez, and I'm the New Jersey Centering Program Manager. What I do here in the state of New Jersey is I work with current sites that are implementing centering. I currently work with the 5 Healthy Women, Healthy Family sites in the state of New Jersey. I also work with potential sites and community partners and partners such as Partnership to bring knowledge about centering, do information sessions, webinars to just expand the knowledge on what centering is. We have 3 different models, and Centering Pregnancy is our flagship model. Centering Pregnancy has cohorts of 8 to 12 women of similar gestational age, and they go through their pregnancies together, starting in their 2nd trimester. They meet for about 10 visits, and it's a billable appointment, and the visits and curriculum follow the ACOG and ACNM practice guidelines. It's a really beautiful way to just connect with your community, get more time with your provider, and in addition to that, share the wisdom and learn about the wisdom of all the women in your community, which is so important.
So I want to thank you for that, and I will have some follow-up questions for you. Right now, I'm going to introduce Deborah Katz. And Deborah, can you provide the information about St. Joe's and your role in centering?
Hi, my name is Debbie Katz. I'm the chief of the nurse midwifery service at St. Joseph's. We started centering back in February. Not the best time to start any program. We were able to do February and March, and then we were waylaid by the pandemic. Centering in Paterson, we're in Paterson, New Jersey. Paterson is a multi-ethnic area. A lot of Arabic women, Bengali women, Hispanic women, a lot from the Dominican Republic, and African American women and women identify as Black. So it's a diverse community, and it's been nice to see everyone sitting in the centering group, regardless of where they're from, and sharing information.
Okay, thank you. So Tracy, we're going to move on to you. Please introduce yourself and your organization.
Certainly, my name is Tracy Myers. I'm a licensed clinical social worker. I am the Director of Community Services at Alliance Community Healthcare. Alliance was formerly known as Horizon Health Center, and I know many people knew us for that name. We're a federally qualified health center, which means we receive a bulk of our funding from the federal government. We serve as a catch net, right? So our population is incredibly diverse. We have folks who are uninsured, undocumented, underinsured, folks Medicaid, Medicare, and some with private insurance. So we really see the wealth of folks who might not otherwise go to a doctor, who might not otherwise have access to services. So our population runs the gamut, as does our staffing. So that's nice. A lot of us are from the community, from the neighborhood. And so we're pleased to be a part of centering and being able to offer everybody these services.
Thank you. Deanna, I have a question for you, another question for you. So this program is funded by the Department of Health, the New Jersey Department of Health. Can you talk about the connection between and the emphasis on health equity and birth outcomes?
Yeah, absolutely. So the centering model, the group care model, delivers better health outcomes and better care experiences for the patients and providers. And our mission at the Centering Healthcare Institute is to improve health, transform care, and disrupt inequitable systems through centering group model. Centering pregnancy is an evidence-based model. So there has been multiple research studies done, and what they see is that there's a significant reduction in preterm birth, specifically for women of color, and especially for Black women with the centering pregnancy model. The studies show a flattening of racial disparities for women in centering pregnancy, with an overall preterm birth rate for Black women virtually the same as white women when they're in the centering pregnancy model versus individual care. Centering flattens the power differential and it elevates treatment of patients, and it really takes into consideration their lived experience. So there's a big focus on health equity, and with the extended time with your provider, the providers and the staff are able to focus on the social determinants of health as well that are affecting the community.
Boy, thank you. That's a lot. And I want everybody to really think about how centering has been studied and proven to really be supportive in terms of health equity and making sure that better birth outcomes happen. So Deborah, and this question can be both for Deborah and Tracy. We talked about implementation. I want our viewers to know, what was implementation like for St. Joe's in Paterson, New Jersey?
Well, I've had heard of centering previously, and many of the midwives were asking if we can do a centering program. But if you know me, change is very difficult. So the state or the partnership actually contacted us, and there was monies because the state was trying to decrease their overall mother and infant mortality rate, and said, we've got centering. And we said, all right, sign us up. And it was wonderful because of this grant money, we were all able to take the courses that needed to be done and set up a special place for the women to meet. So having that partnership support, having that state support, having support from Deanna and the Centering Healthcare Institute really made it easy for us.
Okay, thank you. So Tracy, I'm going to direct the same question to you.
Okay.
Mm-hmm.
So my CEO is, social work bred. So she, is very, very excited at the opportunity. And I was hearing about centering long before I knew what it was. And so we're going to get centering. We're going to do, okay. I had no clue what she was talking about or what was going on. But I just remember during our initial launch, being able to be a part of it and learning and sitting and thinking how many of our patients, this would really benefit. Having these women have the opportunity to sit in a room together rather than in a waiting room, right? On their phones, on their individual phones, feeling very alone, but really sitting and being able to meet one another, because many times, your friends aren't necessarily pregnant when you're pregnant, so to have that kind of camaraderie and get a whole cohort around you. We found that the women were very excited. Whoever we mentioned it to was very interested in it, very excited about it. So it was a pretty good kickoff until, COVID.
COVID, yes. And I just want to let our audience know, we here at the partnership actually applied for funding through the Department of Health. And one of our chief goals has always been to decrease infant mortality and improve birth outcomes, specifically among our African American community. And when the opportunity came to us to apply for this, we had several options. And I, along with a team from the partnership, sat down and we started thinking about what would be the best strategy to help support what we're trying to do. And we all decided that centering would be a great choice for us. And I'm so glad that we were able to do that, because I'll tell you, between Deanna, Deborah, and Tracy, it's really been just a great partnership in terms of working together so that we can definitely improve birth outcomes and decrease infant mortality in the state of New Jersey. So Debbie and Tracy, I'd like to ask you about recruitment. What is your recruitment like?
So the nurse midwives see the majority of the new OB patients in the clinic. So if we feel that someone is appropriate for centering, we approach it more as letting them know this is how we're doing prenatal care now. So it's a opt-out instead of an opt-in, where we say, you know, we're going to sign you up, this is what it's going to be. And once the patients, you know, they're initially a little bit concerned, 2 hours, I'm going to spend 2 hours there.
Yes.
But we tell them you're going to be here 2 hours anyway, between registration and the sitting and the waiting. And this time you get 2 hours of nonstop interaction and snacks.
Yeah, so snacks can be a motivator. But I think
They are pregnant.
one of the things that I've seen is it may be snacks initially, but the bonding that happens. So Tracy, can you speak to that a little bit about the relationships that are formed with the women?
Absolutely. So it's very interesting. So the relationships are formed between the women, but also between the women and the facilitators, right? Which include their provider. So the provider becomes more human, so to speak, more approachable, you know, and our providers have been able to learn a lot from the women in the group, learning a lot about cultures, learning a lot about, you know, family units, how families are conducted and run, and just the different traditions that all the women have, things that the women didn't necessarily feel comfortable discussing in 15 minutes, you know, really being able to sit back for 2 hours with your provider and having that, you know, just really brings everyone together. So they feel more a part of this health center. They ask more questions. They're asking questions about pediatrics, about podiatry, things that you would think not necessarily have anything to do with centering, but it's been a really nice offshoot because they feel so comfortable, you know, and having that time together that they are now comfortable with their health in general. And so they want to learn more. They want to be healthier. They want to, you know, and want to know, can't we do more programming? What about when I have the baby? I want to come back. So, yeah.
And I think Deanna can add to that later. But Deanna, I want to ask you, I know that Centering Healthcare Institute provides training. What has been done, or how have things been configured to really support programs starting to do work virtually because of COVID-19?
That's a great question. So we have transferred all of our documents. So let me take a step back. All of our centering facilitators, provider, and staff facilitators receive a facilitator's guide. And like I said, the curriculum at Centering Pregnancy follows the ACOG and ACNM guidelines, and so does our guide. So each session when they come in, there's something they're going to talk about as a group. And what's great is you're really pulling from the women and what questions they have. So the documents that we have, we've been able to make them virtual. We have them on centeringhealthcare.org. All of our sites, all of our Healthy Women, Healthy Family sites have access to that. They're able to go online, use those virtual documents. And in addition to that, we've had multiple webinars where we're actually showing you how to do a virtual centering group. So you're experiencing it with other sites, you get to learn different activities, and then you're able to take those activities and bring them to the virtual platform with your patients.
Okay, thank you. So I'd like to ask Deborah and Tracy, were you able to carry forth virtual meetings? How were you able to handle the centering circles once COVID hit? Because I know that was right in the beginning of you implementing the program. And so how were you able to do that? And also, how were you able to keep families and patients engaged in this activity? So whoever wants to jump in can.
Go on, Tracy.
Well, we had some difficulty with the start of COVID. We were able, because we're a full medical home, so we remained open. Our doors remained open, but we were very concerned because, of course, little was known about how COVID affected pregnancy, and so we were just very concerned about continuing to bring the women in, and so we wanted to offer them virtual. But what I discovered is none of the women that were in the group that I offered it to wanted to do virtually. So everybody was afraid to come in, but they also were not completely comfortable with virtual, and I said, we'll come in, your next appointment, I'll show you how to do it. And they were just kind of like, no, miss, that's okay. So what we ended up having to do was a lot of one-on-one phone calls and check-ins and sharing information. And people would say, oh, you can tell the ladies, I'm feeling this way the next time you speak with them. And, so it was a lot of that. So they still felt that connection, but they just really didn't adjust to the virtual.
Okay. So Deborah?
So we honestly just put it on hold. We had only met, our July cohort had met twice, and our August cohort had met once. And they hadn't formed those bonds yet. We hadn't embraced everything completely. So we put everything on hold. And most of March, April, May, we didn't hold centering classes. But starting June, when things our numbers in Paterson started to come down, we decided that we were going to hold classes, but not have 12 people in a class. We thought that 6 to 8 at this point gave us enough room to socially space. Everyone wears their mask in class, but starting in June, we started right back up with not only the July and the August, but the ones that we didn't start. So September, October, November, all restarted in June. So we were busy in June. And now we're back up. All of our Julys have delivered, all of our Augusts and Septembers have delivered. And it's just wonderful to see this progress.
Yeah, I think, centering is prenatal care. And sometimes when people hear, they think, oh, those are just groups. No, that is actually your prenatal care. And I know that's emphasized. And once the women become a part of the group, they start to understand that, yes, this is my prenatal care appointment. So we did talk a little bit about the relationships with the providers, but can you expand on that, both Debbie and Tracy? And I'll start with you, Tracy. Debbie,
Sure.
the relationships with the
Definitely. The women initially are very surprised. They kind of think that it'll just be, a nurse or an MA or myself in the room with them. And then I remind them, no, this is your appointment. This is your prenatal appointment. Your provider is going to be there. And the fact that the provider comes and sits there for 2 hours, eats snacks with them, participates in the activities, thumbs up, thumbs down, I agree, these are my concerns, just really, initially the women in the first session or so, they're just kind of not sure what to do with it. And then they recognize that this is a person that they can just speak with. And so what the women have been, sharing is that they feel more open, even during other times when they need to come in. They feel like they can ask the questions, they can be more honest, share some of the thoughts that they've been having, share some of those old wives' tales that, we talk about. And so it's just really nice to see, everybody's face light up once the baby comes, and we can't wait to have some reunion groups so we can see, because we missed some of those with COVID. But just being able to, even myself, because I do assessments for the women, but I don't necessarily get 2 hours, right? So now you feel really attached, and the women feel attached to you, and they've been able to share things with me and difficulties that they've been having that they did not share during their perinatal assessment. So that's been very nice.
Deborah?
I completely agree with everything Tracy said. The camaraderie in those rooms, it's like nothing I've ever experienced. I've been doing prenatal care for 25 years, and this has just been so beautiful and special. How the women help themselves, the women, you're fostering these conversations and communications and discussions, and they take over. And initially I thought, oh, well, you know, we'll keep the primates, the first-time moms, separate from the second-time moms, but it's so much better to have everyone in the same room. Right. And that the second-time moms are telling their stories and telling what worked for them and how they can help themselves. And it really, there's a bonding that happens. Mm-hmm. And it's a short time, but just the fact that these women are going through the shared experience together brings them close.
I just want to, and this I'm going to throw this question out to all of you. You know, when we think about the medical professions and physicians, they have, you know, a unique way, and providers, of thinking about how medical care is provided. How was that transition for them? Can you, I know you can't speak for people, but you've probably had a little bit of, you know, feedback from them. And so I just want to throw that out. And, you know, Deanna, I know that at one point you were a centering coordinator. And so what did that look like for you, or, you know, the physicians that you work with? Because again, this is such a different system that they have to learn that they did not learn in medical school. So if anybody can speak, you know, if you all can speak to that, I'd appreciate it.
Yeah, I can speak to my experience for that. And I'll speak to what I see with like the basic facilitation trainings that I offer that are part of the implementation plan. I see particularly providers from day one, they may be naysayers of the centering model. And by the time they're done with the 2-day facilitation training, they really understand the value. It gives them the opportunity to get away from like that didactic way of speaking and understanding that you're really pulling, I mean, I use the word wisdom because I believe, you know, wisdom, women are so wise, and there's so much that the community can provide and information that you can get, and they can really lean on each other and help each other with resources when it comes to emotional support during their pregnancies. And the provider can understand that the information that they're offering them, the women know, and they can go home and they've learned it. So it's not just like them talking and somebody shaking their head yes in a quick 15-minute, you know, appointment. It is 2 hours, and you create a relationship with the community overall, and you're able to learn things that you didn't know, maybe things that are happening in the community. Mm-hmm. And I've seen that firsthand on when I was a facilitator, that people would open up in the group in different ways, so they wouldn't open up in a quick 15-minute individual appointment. That really provides a lot more insight for the staff and provider facilitators.
Deborah, can you speak to that a little?
We don't have physicians in our centering program at this point. All of the midwives have embraced it fully. We also have nurse practitioners have embraced it fully. Our RNs and nurse educator. Everyone is thrilled with this change, and everyone has seen the positive aspect.
Okay. Tracy, do you have anything to add?
Yes, we have physicians in each group. And initially, while they thought the groups were great and the women, you know, can learn a lot, didn't necessarily see why they should be in the group. And we're part of it really was that concern that once group is over, that they were going to have 50 more patients to see. because they took off 2 hours to do group. So just really kind of changing that mindset and realizing that, you know, you're providing sessions and care for these 6 to 8 women during this 2 hours. That is actually what you're doing, and that it's not going to prolong the rest of your day, and we can all benefit and just sit for a minute and enjoy one another and learn from one another. And they started looking forward to it. I know what you get for lunch today, Tracy. So they've been looking forward to it.
So there's definite perks, but I do know the feedback that I've been hearing has been really wonderful. And again, the embracing of this new model has just been thrilling to me as someone who is kind of sitting back. I'm not participating in the actual groups, but in my partnership with St. Joseph's and Alliance, and certainly Deanna, it's been very rewarding for me. So I'd really like to hear some personal perspectives from all of you in terms of how you feel about this. What does this bring to you? What keeps you motivated? What keeps you saying this is something that I'm going to continue to do, and I'm going to push for this to continue to happen in my community? I know that was kind of a multi-layered question, but I really want to hear, and I think that our audience would really like to hear some of that as well.
Having experienced labor and delivery with some of the women in my groups or some of the other practitioners groups, I feel they have more of a confidence when they're in labor and delivery. They have more of a knowledge base. We have talked about, you know, labor and delivery much more in depth than a 2-hour labor class or, you know, the 15 minutes in the room. So, you know, we've talked about mindfulness and imagery, and we're seeing wonderful outcomes. It's too early for us to, you know, really have statistics yet, but it seems that, you know, the majority of them have delivered vaginally, and breastfeeding. The majority of them are breastfeeding, and I think it just gives them more confidence. So if I can help instill that in somebody, I'm definitely doing my job.
Okay. Tracy?
Well, you know, I'm a social worker, so this is what I do, right? So anything to gather people together, to offer them support, offer them education, offer them an opportunity to improve their health. It's something that was very personal for me because my doctor never told me that I was at a higher risk for preterm labor simply because I was a Black woman, and you know, none of that was ever said to me. And so just thinking, you know, so many things could be done differently. How many other women never have this information? How many other women never know this? And wishing myself that I had had a group. I wish I had a centering group. And so every time it's time to come together, I'm excited because I wish I had had one, you know, because sometimes it was just lonely.
Yeah.
It was lonely. So being able to provide that for people is really all I need.
Yeah. And so Tracy, you know, you said something that touched me because when I got involved in looking into centering and doing the research, I'm a mom of 5. And I thought the same thing. This would have been great for me because, you know, when you have those little ones, sometimes you feel so alone. And
Yes.
to know that there's this group of women who, so yeah, I felt the same way. And so we're hoping that we can definitely build a culture of centering, you know, within our communities. So Deanna, to you, if you would like to respond to that.
Yeah, so 6 years back, which seems like a past life now, I was a centering facilitator and coordinator. And I did it for quite a number of years, went through the implementation process. But through it, I got to meet so many women and their families. And I saw the way centering not just altered the women, but altered the community. Because from it, we had women that were pursuing, jobs as lactation consultants to support other women in the community. They started babysitting chains. They started, support for girls' night outs. They started workout groups, and it just kind of dominoed into this bigger, larger thing that it's not really tangible, right? So, and the love that they have for each other and their babies is really truly beautiful. I mean, when they meet each other at the reunions and they compare birth stories and they take pictures of their babies together, they're really celebrating the fact that they had all this support during their pregnancy. And being a new parent can be so isolating, particularly now more than ever. So having that support through your pregnancy and knowing when you're home with a newborn and you're feeding your baby at 3 o'clock in the morning, there is definitely someone else up, so you don't have to elbow your partner sleeping and snoring while you're nursing. It's great to have that person to reach out to, and that the way it makes an impact, not only for like health disparities, but the way it can just make an impact in the community really drove me to stay with the Centering Healthcare Institute and make this change in the state of New Jersey. This is where I was born and raised. So the fact that we can see the communities here, and it's just the beginning for Jersey City and Paterson, but there's going to be so much more to come. I wish I could just sometimes fast forward to bring all that goodness out now, but there's just so much that comes just from integrating centering as your prenatal practice, rather than seeing it as a program, but making it that's the way that you're offering prenatal care. There's more to come than just that prenatal visit. It really brings the community together.
Thank you, Deanna. And I'd like this is a great segue into asking you, can you talk a little bit about expansion and what's happening in New Jersey? Because I do have to say, yes, I'm from the state of New Jersey and I am proud, and we are doing great things in New Jersey around centering, but can you talk a little bit about the expansion?
Yeah, absolutely. So the state of New Jersey has support from the Berg Foundation, and there's going to be RFAs and funding available for the implementation of 10 new centering sites, 5 centering pregnancy and 5 centering parenting. And this is happening, this winter. And if you look down the road, the long-term goal is to have 50 more centering sites in the state of New Jersey. I think it's just great because we have the support from Nurture New Jersey and the First Lady Tammy Murphy, and the Healthy Women, Healthy Families program really set the stage to make this happen for a larger expansion. And the support of the Berg Foundation, we're having funding for the 2-year implementation process for any sites that are interested in becoming centering pregnancy or centering parenting sites.
And I know that our topic and our focus is centering pregnancy, but can you speak a little to centering parenting?
Yeah, sure. So centering parenting is just well child visits, right? So it follows the Bright Futures guidelines, and it's from 0 to 2 years old. It can be used as an extension to centering pregnancy, so they could go through their pregnancies together, and then they could go through all their well baby visits together, or it could be a standalone model of care for just baby for pediatric visits, or a family model for guardian and baby as well. So it's similar to the centering pregnancy model, where it's facilitated group interactive activities, and it's about 6 to 8 parent-baby cohorts.
Okay, thank you. So Deb, I'd like to ask, you've had one cohort who completed, and can you talk about that group and when you brought them back, and they had their 6-week checkup, and you sent some wonderful pictures, and I hope at some point we can show or view those pictures before we end. So Deb, can you talk about what happened when these women came back with these wonderful babies?
We've actually had 2 reunions at this point.
Oh, 2.
With the 3rd coming up, I think, next week. So it's been truly remarkable. These women came back and they had asked, should we bring the babies, with this time of COVID? So we left it all up to them, and every one of them brought their babies because they really wanted to. Oh, look, there's some pictures.
Oh, that's great.
Can you
Because
all
we
see those
wanted
wonderful
to-
pictures? Yeah.
We wanted to share. So, so that's one of our midwives, Yael, and her August centering group. So it has been remarkable. And the women, one of the women, she's from the Dominican Republic, and she's pretty much here by herself. She doesn't have much support as far as family. And after a few groups, she was crying one time as we were closing, and she said, "This is my new family." And it just makes you feel so warm, and it brings everything together that this is the reason. But the women were all delighted to tell their birth stories, and they even felt comfortable breastfeeding in the room, which we truly supported. And it was a remarkable time.
Yeah. Thank you for sharing that. And when you sent me those pictures, like you, Deanna, on my heart just filled, because to see the smiles on those faces and those healthy babies. And I was looking at the outcomes of the women who've already delivered. And it's just amazing to me that I have not seen any low birth weight babies. Most of the babies are delivered vaginally. It's just, this is what we're looking to do. This is what we're hoping for. So as we talk about centering, how do we go about building a culture of centering within communities? And so I know Deb and I have been talking about some strategies for Paterson. Deb, do you want to talk, and Tracy as well, talk a little bit about, what are your thoughts about, developing that culture so that people see this as just another practice of care when it comes to prenatal?
Hoping webinars like this will allow people to hear about it, word of mouth, a positive response and positive outcomes. And hopefully the women will share these. They've already started in our groups telling family and friends, and people are coming in asking. So we know it's already reaching out there.
Wow.
The providers are actually going to start doing a Undoing Racism program, which all ties in as well. And we're, having a dedicated staff and having, positive responses. I think that's the way to go. And support from our facility. Our administration supports us.
Okay. Tracy, would you like to respond? Do you have anything, when we talk about
Sure.
building that in Jersey City?
Yeah, under regular circumstances, part of what we do is constantly go out into the community. So I've still had some virtual opportunities to go out into the community and talk about centering, as one of our main programs for pregnant women, bringing in other providers, even from the center, to present to the women really helps tie in everybody. And so the other providers began to talk about it amongst themselves and talk about it with people, especially the pediatricians, because, many times it is the woman that brings the family into the center. So maybe some of those women that we missed, so the next time around, they're like, I heard about this program from the pediatrician. And so just really kind of sharing it wherever we can and share the good news.
Okay. And so, Deanna, I want to ask you from a little bit of a different perspective in terms of providers, how have you been able, or I know you've been doing a lot of work, but really trying to create that culture within the profession itself, within that community of practice? How's that been?
So locally within New Jersey, we're offering Centering 101 lunch and learns that will give anybody from a provider to, a medical assistant or somebody that's just working in infant maternal health, just an overview of what the centering model is and how it can be integrated into a practice. It's really important to make sure that there's awareness throughout not only the state of New Jersey, but nationally, recognizing that centering is a way that you can offer care. It isn't a different program, but a systemic change. And these centering one-on-one lunch and learns are being done nationally throughout the United States, which is very exciting, not just in New Jersey. So we also have quarterly consortiums. It happens throughout the US, specifically in New Jersey. We have one each quarter, which brings people all over from the state, from maternal and infant health, into this consortium, current centering sites, potential centering sites, and we're able to share best practices and really share information about centering. We recently just had one in September, and its focus was on health equity, and we have one coming up in December as well. And I just think it's a really fantastic way to share their wisdom, just like in a centering circle, right? You're coming together and building that community.
Yes, I attended that, and it was wonderful. It was really a wonderful event, and I think all of us learned a lot. I'm going to ask everybody to mute themselves because it's a mind. Yeah. So what I'd like to ask is lessons learned. Because with the implementation of anything new, there are always things that we learn. So Deborah, can you what were some of the lessons learned at St. Joe's?
Tracy, why don't you go first? Let me think about that.
All right, Deborah. Okay. Well, honestly, I'm going to say that to encourage folks who are thinking about beginning to bring as many people in the room so that they can hear it at the same time. So we had a little stagnation because everyone who I would have liked to have been there from the beginning wasn't. And so we kind of had to learn as we went along, which I think caused the facilitators to have a harder time because they didn't have that support and that buy-in because everyone didn't know how to give it, So it was just kind of like, oh, what are they doing in that room? And so even after the kickoff, but by the time you kick off, it's really great to have everyone already on board, and this is a celebration. So I would encourage, definitely to me, lessons learned were pluck somebody from every department so that everyone has a different point of view. Every department touches the pregnant woman and the baby. There's just no such thing. But I think sometimes when you're in that planning process, you can't just keep tying people up in meetings and things like that. But it's very important to have representation from every department and as many people as possible.
Okay, thank you. Deb?
True. I really felt this was my baby and I had to do everything. Yes, we had a steering committee, but I think spreading the wealth would have been easier. And I did have support. I just have a problem letting go.
Okay, so that's fair. So Deanna, lessons learned as you tried to bring providers together and you started recruiting organizations and all of that. What lessons would you say there were lessons that you learned along the way?
How important community awareness is, right? How you're talking about centering to your community. And then when you're talking to the sites, I agree that having everybody in and involved, because it's a system change, and having as many people as possible engaged really ensures long-term sustainability for the centering pregnancy model. So making sure that you spread the wealth, right? Spread the responsibilities is super helpful. And I'm grateful that I could still work with Debbie and Tracy during this time. So it's wonderful that we're still all able to collaborate.
Yes, and before I go any further, I would like to invite the audience to If you have any questions, please put them in the chat box. And I will ask Monica, do we have any questions in our chat box?
I'll tell you, Marie, this is a very popular topic. We have a ton of questions. So the first one is, what does a typical centering appointment look like, and what kinds of topics are discussed during centering groups?
So Deb or Tracy?
So the Centering Healthcare gave us a facilitator book, which we base it on, but everyone does their own thing. So there are usually 10 meetings. There were less during COVID because we did have to condense. But there are 10 meetings, and there are topics like nutrition, breastfeeding, labor, personal safety, domestic violence, common discomforts of pregnancy. So centering has a format. There's an opening, an activity, a closing, and within there's also the time for health assessments because everything happens in one room. We also like to tell them that centering starts on time and that it's a safe space, and what's said in this room stays in this room. So the women come in, there are snacks on the table. They perform their own self assessments, blood pressures, weight, urine dips, which we've helped them over the course, learn to do. And also it's do one, teach one. So when we show the women how to do it, then they show the next person that comes in. And it gives them accountability. It gives them feeling of pride to share what they know. And it sets them up to want to talk during the meetings and during the circle time. So we have a screen around a table where we do the health assessments, and that part is one-on-one. And then we have meetings where it's an activity about the topic. For example, Tracy said before, agree, disagree. So in our little centering packets, we have these little placards, and someone will ask a question, everyone will put their agree or disagree, and then that will naturally go into questions and discussions. And we let the women answer each other. But if there's something that we felt, wasn't correct, we would jump in. But women have a lot of knowledge and experience and history, and we want them to share that.
Okay. Does anyone have anything else to add to that? Okay. If
I think
not,
that was beautifully said.
Deb, you were very comprehensive in that.
Yes.
I was picturing the meeting as you were talking about that. It definitely gives the patient a sense of ownership when it comes to their health. So thank you for that. So Monica, do you have another question for us?
Sure. So I guess a quick follow-up to that question is, how do you also comply with Hipaa when you're doing a group prenatal appointment?
So Deanna, can you respond to that, please?
So all the HIPAA sensitive topics will be done in the medical assessment portion. That medical assessment portion is done in the group space, but it is a private area and nobody can hear your conversation. In addition to that, there are confidentiality forms signed by the entire group, and nobody is required to share anything in the group space that they don't want to share. So they're not required to talk or participate if they're not comfortable in a certain topic, because it's more educational rather than HIPAA sensitive medical topics. That's going to be held for their one-on-one with their provider when they have the medical assessment in the group space. Debbie, do you want to add anything? You're a provider. So.
Tracy?
Okay, our next question is really about how does this model specifically prevent preterm labor?
Okay, so I'm going to ask Deanna to answer that.
So we integrate the three things with the centering pregnancy model and the centering model overall. The health assessment, it's interactive learning. And in addition to that, we're bringing the community together. So there is not one specific thing that we've pinpointed that reduces preterm birth, but it's overall how the group comes together. So there's people in a circle, the hierarchy of provider with patient disappears with that. The women have support, their stress levels are reduced. We see that frequently. In addition to that, they feel heard, they're empowered to advocate for themselves within the group. There's so many factors that happen within this group space that really go with what makes preterm birth reduce, that there's not exactly one thing we can pinpoint to say that's the thing, right? I think it's overall bringing women together in a circle to share and share their lived experiences is really significant and something we've lost along the way.
Thank you, Deanna. And I think one of the other things that the audience can do, if they'd like to know more, they can go to the Centering Healthcare Institute website, and you will see research studies. And if you would like to read some of those studies to help you understand, the importance of bringing women together in a group, and as Deanna said, leveling that hierarchy. There's just been some great studies, and some of the things that I've used personally when I'm citing, if I'm writing up something, I can go to one of those research papers and cite them, because it has been shown that it definitely does reduce the incidence of low birth weight and preterm
May
birth.
I add a little side note to that? And it's because I recently did an interview with one of the new moms, and just asking her what her experience was and what she thought. And what really was important for her is that she felt her provider better understood her, better understood what her norms were, where she was coming from. She better understood what was normal, quote unquote normal, what was okay, because she realized she'd been getting a lot of misinformation from different places. She changed everything. She changed the way she ate. She changed, she felt her stress levels went down. So there were so many facets that, this actual participant could tell us, this is what made the difference for me, and she delivered her 9.5-pound baby.
Wow.
So it's pretty cool.
Okay. Are there any other questions for us, Monica?
Yes. So we briefly touched on determining who's a good candidate for the program, but are there any women in particular that wouldn't be a good candidate for this program?
So I'm going to leave that to Deborah and to Tracy, because it's really up to the individual practice. So
In our,
wants to jump in?
so in our practice, the midwives care for lower risk women. Of course, in Paterson, New Jersey, low risk is a little bit wide. There's a lot of low socioeconomic, a lot of obesity, a lot of mental health issues, and we still care for these women, and would still invite them into our centering groups. But at this point, the diabetics on medication, the hypertensives on medication, the twins, the high-risk doctors treat them and see them, and we don't have a centering group for them at this point. If we keep going, our numbers keep, like this, it's something we might consider. But at this point, we're just doing the low risk.
Tracy, would you like to add to that?
Yeah, we really haven't. I agree. Our idea of risk is probably different than, other facilities, but we really haven't found a woman who we just thought couldn't benefit from centering, from very young moms to older moms, first time. One woman was having her sixth child, and she talked about all that she learned, you know, and I'm going to add, this was the first baby she carried to term. Was her
Wow.
centering baby. So out of 6 babies. So, you know, we haven't discovered anyone that just wasn't suitable.
So I think, Monica, the answer to that is whatever is best for that individual practice, and they can make, you know, the decision on who they enroll and who may not be a great candidate. But it's up to the individual practice.
Great. So the next question is really about providers. So people in the audience very surprised that the provider's dedicating 2 hours, and they want to know, how do you get the provider to do that? Is there some sort of incentive? And sort of a follow-up or partner question to that is, you know, if some of the providers are reluctant, how do you get them to actually go to the training?
Deb, do you want to speak to that, and Tracy, and even Deanna? I mean, you have we have 3 minutes left, and I can say that I don't want to say it was a hard sell, but yes, the providers, when we had the initial kickoff, and I think, Deanna, you were present and kind of brought us all together, and Marty was there, and those questions did come up from the providers. They were very concerned about that, and maybe 1 or 2 were reluctant to, you know, to give that amount of time. But I'm going to defer to Debbie and Tracy.
So as far as
I'm
our
sorry.
group,
Yeah.
oh, I'm sorry. So as far as our group, you know, all of the midwives were very interested, and there was no problem with it. But now Medicaid and other insurances are following suit, are paying an incentive per person per meeting. So you know, people worry, oh, well, if I'm here for, you know, 2 hours with, you know, 8 or 10 people, I'm not going to make the same amount of money than if I was seeing individuals. But now there's an added bonus that Medicaid does pay per person per group.
And Deanna, you have maybe about 15 seconds to talk about enhanced reimbursement.
Yeah, the enhanced reimbursement is based off the research that was done in South Carolina. They were the first to do it, and it provides the site with extra funding just for having centering pregnancy at their site.
Yeah. And so, Tracy, how about the buy-in for your providers?
It honestly was set as an expectation, but this is what we are going to do because this is in the best interest of our families. Now, there was still reluctance, of course, but of course, when it comes down from the top down, and this is our expectation, you know, that helps the provider make it to at least to training. But then Deanna was able to just pull them in, and they started interacting with these, you know, activities and things, and they got excited. And so once you actually get to participate, you get excited. And so I think the lunch and learns and things like that are great because it completely sucked me in from the beginning, and I just could not wait to share it.
And I definitely agree to that. So I know we're
one thing. Are we out of time? Yeah,
no,
I think
we have another minute.
I think from the provider perspective too, thinking like you are improving health outcomes for all of the patients that you're seeing. You're not repeating yourself over and over again. While there is centering, there are additional clinic rooms open because they're not full with their centering patients that you would typically see. So when you're really looking at the health outcomes long term, and you're coming from a hospital setting, especially, you're saving money overall for the organization, and you're improving the health of the community. And on top of that, you're getting to know the community, and like Tracy said, you're enjoying it. It's a different experience that you're having with your patient and a different way to offer care.
Oh, wow. Thank you. I know that we can go on and on with the conversation. There's probably a lot more questions. And so to our audience, I will say we're going to send out some information to you. We will try to answer all the questions. I think, Monica, there's a way that we can probably do that. We will provide you with the contact information for Centering Healthcare Institute if you're interested in pursuing or at least looking into bringing centering into your community. And I just want to say to these wonderful, wonderful women, thank you. Thank you for your dedication, your passion, and your commitment to improving the health and well-being of our moms and our babies in New Jersey.
Thank you for having us.
Thank you.
Thank you. Thank you for your support.
Absolutely.